First, how do we support clients with visual impairment? Well, remember, it is all about safety and promoting the client's independence. We start by announcing our presence before approaching the client to prevent the client from being startled. And we must also orient the client to the room and ensure all personal items are kept within reach. We should also maintain a well-lit, clutter-free environment for the client to walk without tripping. And speaking of walking, remember to offer your arm and walk one step ahead of the client when assisting them with ambulation. Clients should be instructed to fill chairs, beds, or bedside commodes with their hands and the back of their legs before sitting to prevent falls. And finally, during meals, describe food locations using the clock method to promote adequate nutrition. So if on NCLEX you have an option to feed a client with visual impairments, this is not correct. Instead, we should tell the client their mashed potatoes are at 3 o'clock to promote independence. So now let's briefly review the eye problems that cause visual loss that you are most likely to see on NCLEX. First, we have glaucoma, which is all about increased intraocular pressure that can damage the optic nerve. And remember, there are two types, chronic and acute. Next is cataracts, which causes a cloudy or opaque lens to develop slowly over time. Think of it like the lens fogging up. And finally, retinal detachment, where the retina peels away from the back of the eye. So which two are emergent conditions that require immediate intervention? Remember for NCLEX, acute glaucoma and retinal detachment are emergencies that cause permanent vision loss if left untreated. So would you know how to spot these conditions? Well, you will by the end of this video.